While the vaccine rollout is good news, there are still so many questions. Joining us now to help answer them is Dr. Leo Lee, Infectious Disease Specialist with Beverly Hospital. We want to thank you so much for joining us, Dr. Lee. First off, what can you tell us about how things are going in your practice and at your hospital?
Well, good morning. Thanks for asking. It is quite dire right now in our hospitals. Since we last spoke right before Thanksgiving, our numbers have skyrocketed, and a lot of that can be attributed to the Thanksgiving holiday. And now we're starting to see a rise from the Christmas holiday. And unfortunately, I think in the coming weeks, we'll be seeing the rise from the New Year getaway. So it is quite serious. We do have a lot of family members coming in, lots of people on ventilators. Our ERs are packed. In fact, most of our hospitals, the ones I work out of, are so saturated now, we've got people waiting in the emergency room because we don't have beds for them.
And that must really take a toll on staff.
It is. We are stretched thin. In fact, a fair number of our staff members have actually become infected as well. So that's actually cut into our staffing. So we've actually increased the staffing ratios with our patient-to-staff ratios, which makes it extremely difficult and challenging.
Now, Dr. Lee, there are lots of questions about the differences in the Pfizer and the Moderna vaccine, and then the next likely one to get authorized, the vaccine from AstraZeneca. Can you explain the differences? Does it matter which one you get, or should people wait to get a certain one, or just take whichever one you can?
No, you should get whatever becomes available to you. The Moderna and the Pfizer vaccine are very similar. In fact, they use the same technology. What they basically use is what we call a messenger RNA, which is basically a blueprint for the manufacturer or construction of the spike proteins. We've all seen pictures of the coronavirus. We see those little red spikes. Well, basically, the vaccines are blueprints for manufacturing those spikes. So the Moderna and the Pfizer vaccine actually use the genetic material, the mRNA, and that's actually injected inside a little fat bubble, which is probably the best way of describing it. It's injected and it's taken up by the cell, which subsequently reads that blueprint and produces little spike proteins. Now, the AstraZeneca, which is probably the next vaccine coming up, uses a slightly different technology. Instead of using the messenger mRNA, it basically uses a double-stranded DNA, which some people would say is the original blueprint, whereas the mRNA is probably a copy of the blueprint. Now, instead of putting in a fat bubble, the double-stranded DNA from the AstraZeneca is actually incorporated inside a modified chimpanzee adenovirus. So viruses can actually be used to deliver basically the genetic material into our cells, but it's been modified in such a way so it won't cause problems and it can't replicate on its own.
So they all work very well.
They all work. They all work very well, and it's recommended that if you get one type of vaccine, you get the second vaccine. All of them require 2 doses. The Pfizer requires 2 doses 3 weeks apart. The AstraZeneca and the Moderna require 2 doses 4 weeks apart. And if you do take one vaccine, you have to take the same manufacturer with the second dose as well. You don't mix them up.
That's a good point. That's a good point. Dr. Lee, thank you so much for being here. We appreciate you this morning.
Well, thank you for your time. Happy New Year.
Happy New Year. Have a good day.